I'm Dwayne Brown. Tonight on KPBS Evening Edition, the race is heating up for Senator Barbara Boxer's seat. We'll tell you about a lawmaker from Oceanside who thinks he has a shot at winning. And at Camp Pendleton, an inspirational competition for active members and veterans, helping them grow stronger physically and mentally.
Plus, how would a Supreme Court's decision on healthcare exchanges impact medical insurance cost and coverage in California? I'm Peggy Pico with that conversation, and about 200 developmentally disabled people and advocates rallied at the state capitol to ask for funding to restore services. Why California spends less money than other states on developmentally disabled services and its impact on San Diego families.
Hitting the right notes, hands-on lessons challenging students in the sciences and the arts. KPBS Evening Edition starts right now. Hi, good evening. Thanks for joining us. A state lawmaker from Oceanside wants to become the next senator from California. Republican Assemblyman Rocky Chavez says he'll run next year to replace retiring Senator Barbara Boxer. Chavez has served 2 terms but isn't well known statewide. His announcement does change the dynamics of the race, where State Attorney General Kamala Harris, a Democrat, is the only other candidate running so far. Chavez says he's a proven vote getter.
You know, we have some real troubled times in our country right now. What's going on in the Middle East, you know, you turn on your TV and you see with ISIS. Those are big challenges we have facing us. And I think California residents need to think, who would they like to send to D.C. to represent them? Somebody who's a lawyer from the Bay Area or a Marine?
On tomorrow's Evening Edition, why this may be a risky move for the Oceanside Assemblyman. Peggy Pico will have an in-depth interview tomorrow night. San Diego's mayor wants to fill potholes faster and spend the city's money wiser. Today, Mayor Kevin Faulconer announced plans to double street paving next year and improve how the city gets repairs done. Councilman Mark Kersey chairs the Infrastructure Committee. He says the updates will save time and taxpayer dollars.
These are common sense reforms, such as putting contractor bidding online, eliminating duplicative environmental reviews, and establishing better coordination between city departments.
Some of the changes will come before his committee next week. Helping the environment, San Diego is working on big plans for the future. KPBS reporter Claire Trageser has more about the city's climate action plan and a group serving as its watchdog.
San Diego continues to grow in size and population, and all of that growth can hurt the environment. So last fall, Mayor Kevin Faulconer released a plan for how the city will tackle climate change. As it stands now, that plan has several ambitious goals. One, to change the way people get around. Right now, 87% of San Diegans commute by car. By 2035, the plan hopes that will drop to 50%. That means the number of people taking public transit will go from 10% to 25%. The number of people who walk to work will go from 1% to 7%, and the number of people who bike to work will go from 1% to 18%. 2, to have 100% of the city's energy come from renewable sources by 2035. That means solar power, wind power, and hydropower. 3, to install 30,000 electric vehicle charging stations by 2035. The plan also wants 25% of cars to be electric by then. 4, to have 90% of our garbage not going to the Miramar landfill. That means it would be recycled and composted instead. Sound like a lot? Faulconer recently told KPBS Evening Edition he is confident the city can do it.
It's important, and I know we can achieve those goals. I know they'll be, won't be easy, but at the same time, when we look at the world-class leadership we're doing already on solar energy, just as one example here in San Diego, we can build upon that.
But the plan isn't final yet. It'll go through a long review process where it could be changed. Nicole Capretz is worried that might mean the ambitious goals will be scaled back. So a few months ago, she started the nonprofit Climate Action Campaign to be a watchdog over the process.
We want to make sure the city keeps the climate plan as ambitious as it is right now in its draft form. And I think that's going to be really pivotal, because there might be some interests that would like us to water down the plan. And so I don't know who those interests are, but, you know, given past history, it seems like that's a possibility. So we'll be watchdogging to, you know, just sort of make sure the city stands its ground and the mayor stands their ground and the council stands their ground and stands behind this amazing, groundbreaking climate plan.
Capretz is one of 2 paid staff members and is funded by grants and private donors. She didn't want to say who. She's been meeting with community and business groups to explain the climate plan and ask for their support.
But I think it's important for you to know that the city doesn't really have a plan to figure out what we're going to do when sea level rises. What's going to happen when the flooding starts coming through the convention center and into the Gaslamp Quarter? What does that mean for your business?
Capretz made those comments to the Gaslamp Quarter Association's Hospitality Committee. The group's co-chair, Nathan Wing, liked what he heard.
Based on her presentation, I think it's a cause that we can get behind as long as we get the board support. But from what I saw personally, I think it's definitely an interesting thing to talk about, and it's definitely things that businesses can benefit from.
And that's Capretz's goal, to get as many smaller groups as possible on board with the bigger climate plan.
An example is that part of the climate plan, of course, is figuring out how do we provide transportation alternatives other than the automobile. So the fact that we can say, hey, the larger context for the reason why the city is looking at transforming our streets so that they're more people-friendly is not just because there's a specific developer who wants and needs to just put in bike lanes to get maybe a green certification. We're actually doing it because it makes the community healthier, it reduces our carbon footprint, it provides alternatives. Millennials seem to want a different kind of urban experience. Like, when you put it in that larger context, I think people, again, see things differently and are more open-minded, maybe, potentially, when the city or a private developer comes with a project and could see it in that larger frame.
The climate plan also could involve something even more ambitious. It's called community choice aggregation, which could change the way the city gets its energy. We'll explain it more in part 2 of this story next week. Claire Tregesser, KPBS News.
From planning to taking a closer look at salaries for elected officials, the San Diego City Council Committee is starting to talk about changing the way salaries are set. Right now, council members vote on whether to give themselves raises. The head of the Salary Setting Commission says city leaders' pay should be linked to judges so they get a raise when judges get a raise. The suggestion may be put before voters next year. San Diego, be ready to pay up. We're learning new details tonight on what it would take to keep the Chargers in town by building a new stadium. A study by National University shows the county would have to foot 65% of the cost. That's based on what other NFL cities have shelled out. It also mirrors funding estimates from the team's council.
Save our Bulls! Save our Bulls! That's right.
Thousands of fans showed up Monday in Chargers gear for the first public meeting with the mayor's stadium task force. Chargers fans started a new online petition calling for the team to stay in San Diego. They've already gathered more than 6,000 signatures. Now, if the stadium talks fail, the Chargers may be heading north to Carson. Plans to purchase property there are moving forward. The proposed site would be shared between the Chargers and its rival, the Oakland Raiders. Supporters could begin collecting petition signatures as soon as next week. Carson City Council can approve the stadium plans outright or place the project on the ballot. Vaccinations may become mandatory in California for daycare workers. In response to the state's recent measles outbreak, new legislation would require all adults who work in preschools and daycare centers to get vaccinated against measles, whooping cough, the flu, and other diseases.
We're talking about child care providers who work with small children. If they're not vaccinated or properly vaccinated, then they themselves could be carriers or could be spraying any kind of infection among these small children. So we got wind of it that way, and we were able to now look into how do we make this, or how do we remedy this problem.
Right now, daycare workers are not required to get vaccinated. Since the measles outbreak at Disneyland in December, 131 cases were reported in the state. When a California woman took a Down syndrome screening test for her unborn baby, she didn't expect to find out she herself had cancer. Such results are rare, but KPBS science reporter David Wagner says they point out possible advances in cancer diagnosis.
Eunice Lee got more than she signed up for when she took a non-invasive prenatal test made by San Diego-based Sequinome. The Santa Barbara anesthesiologist was 40 at the time. Such tests are now routine for pregnant women her age. They use a maternal blood sample to screen for chromosome problems in a fetus. The results from Lee's Maternity 21 test came back with lots of problems, but they weren't problems with the fetus.
No, I didn't think it was going to reveal anything about me at all, and it did.
The faulty DNA floating in her bloodstream was actually evidence of cancer. Further testing confirmed she had a tumor in her colon. She was rushed into surgery and had it removed.
Later on, I had a healthy son who is now 3 months old and is doing great.
Lee told her story at the Future of Genomic Medicine conference in La Jolla. Sequinome's test was not designed to detect cancer. The company says less than 40 women have been diagnosed with cancer after getting unusual Maternity 21 results. But these few cases suggest blood testing could be an effective new way of spotting cancer early. Some experts think women should be warned that surprise discoveries are possible when taking these tests. But Lee says in her case, it all turned out for the best.
I think, if I had not taken the test, I eventually would have been diagnosed with colon cancer, but I would have been diagnosed at a later time.
To this day, follow-up tests have shown her to be cancer-free. David Wagner, KPBS News.
Supreme Court justices are getting ready to cast their votes tomorrow in a case over the future of the Affordable Care Act. It drew protesters from both sides to the steps of the Supreme Court for oral arguments Wednesday. Peggy Pico has more on what's at stake.
For the second time, President Obama's Affordable Care Act, or ACA, is before the Supreme Court. This time around, the justices will decide on a lawsuit over federal money used to help people pay for mandated medical insurance. Here with how the ruling could impact the future of Obamacare are my guests, Cal Western's constitutional law professor Glenn Smith and Susan Chanik, director of the Institute for Health Law at California Western School of Law. And Glenn, this case is not about the constitutional viability of Obamacare.
That's right.
So what is the basic argument? What's it about?
What the legal issues are about is the proper way to interpret 4 words in a 1,000-page law. And whether specifically whether the IRS's interpretation should be followed or whether it's inconsistent with the law and therefore it should be ignored. That's what the basic issue is about legally.
What are the 4 words and what's the argument against it?
The 4 words are established by the state, which said subsidies are only available to people that buy insurance on exchanges, quote, established by the state. And of course the challengers say it means what it says. But what the government says is you have to understand that in the broader context of the statute, which was designed to subsidize everyone in every state buying health care, regardless of which exchange they bought it for. It's a term of art, and it has to be understood in context. So in those ways, it's really a classic fight about statutory meaning and congressional intent and the power of agencies, but it has these big implications.
It has huge implications. And Susan, how would a ruling against the government, in other words, how would the ruling saying yes, this interpretation is correct, affect the Affordable Care Act nationwide?
Well, the biggest effects are going to be felt in the 34 states that did not establish their own exchanges, that relied on the federal government to establish their exchanges. And there are about 8.5 million people who are going to be affected, that is, will lose their subsidies as a result, and for whom insurance will be unaffordable. So that's the first thing that's going to happen. The second thing that's going to happen is in those states, the exchanges, the marketplaces on which these individuals buy insurance are going to experience this death spiral that, we've been hearing about.
Yeah, clarify that, the death spiral
Sure.
being having to do with who can afford insurance, who can't, and who buys into the insurance.
Sure, and it isn't even so much who can afford insurance. The subsidies were also intended to induce young, healthy people who would otherwise not buy health insurance or might not buy health insurance to buy health insurance because it's pretty inexpensive and they have to pay a penalty that's getting more and more expensive. So they might as well get something for their money. As soon as the subsidies go away and prices go up, those young, healthy people are going to drop health insurance and drop out of the pools. And that means that these insurance risk pools that are being used in the exchanges are going to get sicker and sicker, and health care premiums, or health insurance premiums rather, are going to keep going up and up until probably the exchanges kind of blow up in those states.
And that's in those states. Now, California has our own exchange, Covered California.
That's
so
correct.
What kind of impact would that have here?
It's not going to have any impact on the exchanges at all, at least not immediately, and I'm not sure that it's really going to have any lasting effect, because California is still going to be eligible for subsidies, and so that the same pattern of purchasing that's been going on for the last year and a half is going to continue in California.
And Glenn, could you see that people, though, one repercussion might be that people from these other states might be flooding into California, and what that could do to one market here?
It could be, and it could be a drag on people leaving California who otherwise would, which, I mean, I certainly understand what Susan's saying. There's no direct effect, but since in a modern economy and society, we're all affected by what happens in other states, just including having people that are sicker from other states that are traveling. It might have indirect and ultimate effects.
Sure. I'll ask both of you this. Let me start with you, Susan. Any idea on how the justices might rule, especially since Chief Justice Roberts was silent in yesterday's oral argument?
Yeah, he was pretty silent. Well, the liberal four who are going to vote against, or for the government's interpretation, and against the plaintiff, are going to have to be joined by somebody else, and that somebody else is going to have to be Justice Kennedy or the Chief Justice. There was really no indication from the Chief Justice at all. As you said, he was very silent yesterday. Justice Kennedy, however, was not so silent, and he latched on to one argument that might, as it turns out, have some effect on the outcome of this case.
Glenn, I see you nodding. Do
Yes.
you think that you agree?
Oh, definitely. He, in other cases, has become attracted to an idea that really only resonates with him, but is enough to get him to vote a certain way. And so I think it's more likely after yesterday's argument that he might vote for the government than I certainly thought before. It's always a danger to try to handicap an ultimate ruling based on what happens in a 1-hour oral argument, but it's a fun practice,
Sure.
and it's at least better than nothing.
Well, I understand we'll have to wait till June for this decision. We have a
That's
lot more on our website, kpbs.org. Susan Chanik and Glenn Smith, thank you so much.
Oh, you're welcome.
The latest movement in education combines the arts with science, technology, engineering, and math. It's called STEAM. KPBS education reporter Matt Bowler explains how San Diego is leading the way.
This and this have a lot more in common than you think.
You can't have good engineering without creativity. It's just not possible.
That's Kim Richards, co-founder of STEAM Connect. STEAM Connect is honoring 2 San Diego organizations for bringing the arts and sciences together for a more complete education. The San Diego Youth Symphony and Qualcomm's Think A Bit Lab. Lab teacher Sarah Nadir wants educators to jump on the STEAM bandwagon.
It's right there, like if you're not on it now, like you need to be on it now.
The Think A Bit Lab is a place where K through 12 students can learn about being creative in engineering. 11-year-old Elias Sakab from Chula Vista's Camarina Elementary School was at the Think A Bit Lab learning computer code and putting it to the test.
Well, we first wanted it to be like a crazy bull, but we couldn't find a bull, so we just made a head that moves.
From science informing art to art informing science, creativity can come from any place. Chula Vista 7th grader Luna Enriquez says music helps her understand math.
If you don't understand a problem in math, you start thinking about it musically. Say, okay, I don't understand this, so I have to think of something that I already know.
San Diego's Youth Symphony Opus Project teacher Lowry Casimiro says music is a great place for kids to develop their intellectual chops.
This is a crucial time in their neurological development, and this is the only chance we've got to build these bridges in their minds.
In other words, this and this
Amazing!
are necessary to teach the whole child. Matt Bowler, KPBS News.
A new report finds California has slashed funding and services for disabled children and adults by $1 billion in the past decade. Peggy Pico takes a look at the consequences in San Diego and the push to restore them.
California spends the least amount of any state on funding services like housing, work programs, and caregiver assistance for people who are developmentally disabled. That's according to a new report by the Association of Regional Center Agencies. The group joined more than 200 advocates and developmentally disabled Californians who rallied at the state capitol yesterday to ask the state to restore 10% of the funding cut during the recession. Joining me with the details is my guest, Carlos Flores, with the San Diego Regional Center. And Carlos, I understand there are more than 280,000 developmentally disabled people living in California. How many live here in the county, and what kind of services are they in need of?
The San Diego Regional Center services San Diego and Imperial counties. In that two-county area, we serve 23,000 people with developmental disabilities. The services vary widely because we serve babies and we serve people well in their senior years. So infant programs, respite for families, day programs, supported employment programs, supported living, behavior programs. There are many, many, many services that we provide.
State Senator Jim Beal said this about increasing funding at yesterday's rally at the state capitol. Let's listen.
The prison system is getting a $10 billion increase in their budget this year. I think, the fact that they don't have a COLA again for the umpteenth time, they kind of get ignored. There's no big, powerful, well-funded lobby, political donations or anything like that for these people. It's like 300,000 people that have developmental disabilities.
How much funding has the county lost for services to this population since the recession?
Well, I'm not as sure of the county statewide. During the recession, we lost about $1 billion in allocation from the state budget.
So $1 billion over the last 10 years.
Over the last 3 or 4 years during the recession.
Oh, just in the last 3 or 4 years, so even more. I know a little bit of it restored back in 2006, but that was just kind of bringing the money back up to what it was before.
Correct? Well, that was before the recession started. So service providers, they received a rate freeze in 2000 when the problems first started. Their rates were adjusted slightly in 2006, a 3% increase. So a rate freeze in 2000, 3% in 2006. That's the last increase they've seen.
So the impact here in San Diego County and Imperial County and throughout the state, what's it been having that amount of money cut from a budget?
For our service providers, it's been devastating. Even before the recession, the rates were not adequate, and they've had to fundraise just to survive. So they've had to double, triple those efforts in order to survive. Across the state, many have not survived. We've lost 435 residential homes in California since 2011.
More than 400. And what happens to those people?
The services go away. We need to find other ways to help people with developmental disabilities.
Now, coming back to the money, families and advocates were asking California legislature to immediately restore 10% of the lost funding. How much money are we looking at here, and what would it do for people here in San Diego and in California?
You mean how much money statewide are we looking at?
Sure.
About $400 million, I believe the figure is. And what it would do, it would give our service providers some relief. They're under stress. They're on the brink of closure. And it's a Band-Aid right now. The rates system in California is a mess. And the Secretary of the Health and Human Services Agency has a task force committed to fixing the rate system. But until that happens, and that'll take some years, they need immediate relief.
Sure. So at this rally, we saw people wearing the 10% Band-Aid, as in it's not a permanent fix, but it would certainly help. And you said here it would actually improve the ability to get people the services that they need.
It improves the ability of our service providers to survive.
Just to survive.
Just to survive.
What kind of response did the state give on the state capitol there from this rally and from this request?
I was encouraged. Yesterday there was a hearing of the Assembly subcommittee on our budget issues, and I was very, very encouraged by the results of that hearing yesterday. And we do have legislative support in many areas, including locally. Our senators have joined Senator Bell for Northern California locally in supporting it. I can mention Senator Anderson, Senator Block, and Assemblymember Mainshine, who've been very active in supporting this.
And supporting in this. And all right, so just very briefly, is there a place that someone can go if they need some help for services for somebody who's developmentally disabled?
If it's in San Diego or Imperial counties, they come to us, to the San Diego Regional Center. And if it's across the state, they go to their local regional center.
All right, Carlos Flores, thank you so much.
Thank you for the opportunity.
I'm Gwen Eiffel on the next News Hour. Foreclosures in Florida, making sense of a still struggling real estate market. That's Thursday on the PBS News Hour.
They're getting ready for a Paralympic-style event. 250 Marines and veterans are training to take part in the 5th annual Marine Corps Trials. They start this weekend at Camp Pendleton. The trials are hosted by the Marine Corps' Wounded Warrior Regiment. The idea: to give wounded Marines a chance to further their physical and mental rehabilitation. Athletes will compete in 8 sports, including basketball and sitting volleyball. Some competitors say preparing for the trials has made them physically and mentally stronger.
We're learning from the guys who've already done a lot of this process, seeing the way they do things. And then not only that, I feel like I'm racing a clock, and I'm racing myself more than anything else. So I'm just happy to be around all these guys, and you know, they're all inspirational, and they help me out. You know, it humbles you very quickly.
Well, the public's welcome to support the athletes at Camp Pendleton this weekend. The weather is heating up in San Diego. We're looking at temperatures near 80 at the beaches. Look at that, upper 70s. For the inland valleys, even warmer, low 80s and upper 70s. Mountains are looking good in the 60s, a bit cooler. 70s and 80s in the desert if you're headed that way. You can find tonight's stories on our website, kpbs.org/evening edition. Thanks for joining us. You have a great night.